I'm Professor Brian Lowery, and this is the Leadership for Society Daring Dialogues course at the Stanford Graduate School of Business. And this quarter, we're tackling the challenges of leading in divisive times. And today I'm talking with Dr. Tom Frieden, the former director of the Center for Disease Control, the CDC, and the author of the book, Formula for Better Health: How to Save Millions of Lives, Including Your Own. Dr. Frieden, thanks for being here.
Great to speak with you. I'm looking forward to the conversation.
Fantastic. So let's start from the beginning. You trained as an infectious disease physician, and then you became a public health official. And so that's not, that's a relatively, I wouldn't say it's common, but people make that transition. Obviously, to be in public health, you need to be a physician in this position. But I'm curious for you, what led to the transition from individual health and being a physician to more of a public health official, a public health role?
The area that I worked on when I was in my epidemiology training was tuberculosis control. And tuberculosis control is really inherently a community-wide, even a political issue. I finished my training in New York City at the height of the HIV-TB epidemic there. And then I was put in charge of trying to control the TB epidemic. And that's a huge challenge. And you realize that, yeah, you can be as good a clinician as possible and treat individual patients really well. But if society and government isn't doing a good job controlling tuberculosis, all of your work is not going to get much done because more and more patients are going to get sick. So ultimately, public health is about supporting communities and individuals to maximize health within available resources and given the preferences and the involvement of communities.
Mm-hmm. So I'd love to hear a little bit about your book. So you say Formula for Better Health, like that's the opening part of your title. What is the formula? Can you give us the succinct version of the formula?
There is a formula, an approach that has saved millions of lives. It can save millions more, and it could save your life. And that formula is see, believe, create. See the invisible, see trends, whether it's in microbes or toxins or programs succeeding or failing. See why we don't act on those trends all too often. See the technically rigorous path to progress, not someone's hunch, but what really works. So that's seeing the invisible. Believe the impossible. Shatter the illusion of inevitability. There are so many things in our society that look like they're always going to be that way. But for many of them, it doesn't need to be that way. And there are ways systematically to strengthen belief in the possibility of change. And then the hardest part, create a healthier future. And that means working together to organize well, simplify, communicate, and overcome barriers, because health programs always face barriers, but there are systematic ways to overcome them. And then take that see, believe, create approach, apply it to public health to prevent the next pandemic, and apply it to your own health, to live a long, healthy life and be able to do the things that you choose to do for longer.
Yeah, so you mentioned the pandemic, and by the way, I'm really, that's an interesting formula. See, believe, and create. I like the succinctness of that. It's very clear. How were you involved in the COVID pandemic? And then I'm gonna again think about some of how this is connected to your see, believe, and create. But I'm curious first, like how you were involved in the COVID pandemic.
So I was no longer either health commissioner of New York City or CDC director. I was running the organization that I founded, Resolve to Save Lives. We were already working in dozens of countries in Africa or elsewhere. We partnered with them so that they could respond rapidly. We strengthened something that's very relevant for management called incident management systems in more than a dozen countries in Africa, Asia, and elsewhere, working with the national governments. So it was really tragic to see through all of 2020, the US government not have a structured way to respond. And because of that, a lot went wrong in that year. So I would say our involvement was primarily global in that we supported countries around the world. We also worked in the US And when the US CDC was basically told not to speak to the media, because I was the prior CDC director, I had literally thousands of interview requests. So I did a lot of media in 2020 for that reason, really to fill something of the void left when CDC was silenced and to try to promote a fact-based approach to COVID. And I think we still haven't really had a reckoning with what went right, what went wrong, what would we do differently, and what do we need to do now to have a healthier, safer future.
Mhm. And I appreciate you saying there wasn't a structured response. One of the things that people talked about was the continuing changes in guidance, right? So on masks, on gathering, on even after the vaccines, on boosters. But the science also changes, right? So science is not static. There's not an answer. We don't have the right answer at the beginning, and then we're just trying to communicate it. We have to evolve as the science evolves. How do you manage that?
Yeah, it's a great question and a really fundamental issue. One of the things is communication. Essentially, you have to begin every discussion with, based on what we know now, here's what we recommend, and this might change. And if you look at what CDC said in 2020 before it was silenced, Dr. Nancy Messonnier really had it exactly right. This is exactly what she was saying. She was saying, this could be really bad. We don't know. The best thing is to prepare. Disruption to everyday life might be severe. When she said that sentence, stock markets fell, the White House flipped out, and CDC was silenced, essentially for the remainder of the year. But that's what it comes down to, leveling with people. Tell them what we know, what we don't know, how we know what we know, and what we're doing to figure out what we don't know. And that's the essence of good communication. But also, there's real importance in being clear about the levels of certainty. And I discuss this in the book, The Formula for Better Health, because I think it's not well understood. And I really would divide things into 3 or 4 categories. There are things that are virtually certain. There are things that have very strong scientific evidence. For those, we have to confess that some of them are going to be wrong. There are things that have some scientific evidence. There's at least one well-done study, but it could certainly be wrong. And then there are hunches, which are a combination of misinformation, some of it which people are trying to monetize, uh, convincing sounding rationales, wishful thinking, and things that might be true or things that have been proven false. But it's a grab bag of things that don't fall into one of those 3 categories of virtually certain, strong scientific evidence, or some scientific evidence. And as we increase our understanding of science and facts and educate people, I think it's important that we have some clarity about that there are degrees of certainty. I was in one focus group at the height of COVID, and I remember one woman said, I just want to know, what are the facts and just don't change again. I'm sorry, but that's not how science works. Science works incrementally by learning more. It's said sometimes that at the end of every scientific article, there's a line, more research is needed. And yeah, that's partly because they want more research money for their projects, but it's partly because the more you understand something, the more you know what you don't know. And good science doesn't engender certainty, it engenders humility. And that we tell you with a high degree of certainty that if you smoke cigarettes and don't stop, you've got at least a 50-50 chance of getting killed by cigarettes.
Mhm.
We're virtually certain of that. Um, On other things, it may be significantly less likely that we can give you a virtually certain recommendation or conclusion.
Mhm. You know, I'm struck by the story of the woman who said, "Look, I just want the answer, the right answer, and don't change the answer." When you're trying to educate people about science, and this you just gave a very eloquent explanation for how science evolves, right? That we learn as we go, and at some point our certainty increases to a place where we feel confident, but it takes a while to get there. In a situation like the pandemic, the politics of getting people on board with action, of convincing people to sacrifice, is a situation where it might be hard to tell people, look, we don't know, but we don't want you to go out. We don't want you to go to your church service. We don't want you to eat at restaurants. We don't want you to see your family. That's a big ask of the public. And then to say, well, science is hard, so we're not sure. Maybe we're wrong. Is that politically viable?
I think a lot depends on effective communication.
Mm.
And that starts with listening, right? We have two ears and one mouth. Good communication works well when we understand what are people hearing, what are they seeing, what are they believing, what are their information sources. When it comes to the kind of choices that you just outlined, and I will say that I was pretty consistent about this through the pandemic. We believe, and in fact, my organization, Resolve to Save Lives, promoted a risk alert level framework approach where it's an objective fact how much COVID is there in the community. That's a fact, right? That's not a judgment call. It may be hard to estimate. Wastewater is helpful, surveillance, testing, various things are helpful. But that's a fact. How many people are hospitalized for COVID? That's another fact. How many people died from COVID? That's a fact. A little harder to calculate, but it's a fact. But if you think of a risk alert level system, so first, no COVID. Second, little bit of COVID. Third, moderate amount of COVID. Fourth, lot of COVID. All right, at each of those levels, basically, how hard is it raining COVID in your community this week, this month, today? Based on that, different communities will come to different conclusions. It's kind of like ozone levels or wildfire risk. Right? Think about wildfire risk. If you say, there's a heavy wildfire risk, we don't want anyone lighting fires for campfires or cooking in the woods because it may cause a really big problem, right? Well, that's kind of similar to what if you've got all of your hospitals completely full and COVID is still spreading widely and it's causing a lot of deaths and it's before we have vaccine, before we understand treatment, then things that are going to trigger a big increase are going to have implications not just for that person, but for lots of other people. In contrast, if you've got a little bit of COVID or some COVID spreading, you got slack in your hospitals where they can still see more patients, you've got a vaccine, that's a really different environment, a very different context. And different communities are going to come to different determinations at the same risk alert level. Maybe at a moderately high level, some community says, we really are worried about our seniors. We're going to stop visits to the senior centers except from close families, and we're going to require people to wear masks there because we know that the seniors are dying here. Other communities may say, no, we want people to visit their loved ones. This may be, not much longer that they have with them, so we don't want that. So I think you have to really have objective data and then clarity about what decisions are being made, why, and by whom. And then you can bring people around more.
Yeah. You use the word communities quite a bit, and this is public health issues we're talking about. I wonder what happens when the communities are not defined geographically, because that's kind of implied in the way you're describing communities, but you can think about them in different ways. So when you think about COVID, there were communities of people who were at more risk within a geographic location than others, right? So you had people who maybe they were older or had pre-existing conditions, and you had people who were young and more or less healthy, and the risk profiles are different. And now the younger people are being asked to sacrifice, not on behalf of like their communities they understand themselves as a part of it, but as a broader community they may not necessarily identify with. How do you deal with those kind of differences in the interests of individuals within communities or subcommunities?
Well, first, I think it's really important to recognize that there are different communities. When I was health commissioner in New York City, our emergency preparedness unit did a brilliant thing. They came up with a mapping of 41 separate communities in New York City, defined by language, immigration, culture, politics, geography, different areas. And then they mapped essentially the information architecture and decision architecture of each of those communities. Where did they get their information? What radio stations did they listen to? Who were the community leaders? What were the main institutions? Who were the opinion leaders there? And then they reached out to them before there was an emergency. So that then when there was an emergency, we had a way of engaging with different communities that might be isolated because of language or politics or geography or whatever. And the role of public health is to try to support health everywhere. I think sometimes, frankly, public health people miss that point, that, we understand the need for very special outreach to communities that have experienced historical injustices. But, people who live in rural areas are disaffected because of lack of jobs and a bad economy, and don't trust government. They also need very special outreach, like that woman I mentioned before who said, I just want to know, what the facts are, don't change them. Your broader question of how do you get one community to support another if they don't feel tied into it, I think really does relate to the question of empathy and being able to make clear to people not numbers or statistics, but lives and what difference this makes for individuals. And this is something I think media and social media can both help and hurt with. So we need to figure out how to use the media well to support empathy and support understanding of what other people are going through.
Mhm. And this also brings up another thing that's really, I think, very prominent in the news, and I think people's consciousness right now, which is political polarization. So now you can think about political communities and thinking about the political polarization of many issues, including public health. So how do you, once it becomes politicized, like how do you respond when people now think, for example, vaccines are interesting because it's like left and right that have different reasons, but vaccines and mask mandates in the past, all these things have now become tied into political rhetoric, party politics. How do you deal with that when you're trying to support the health of the overall community?
Well, first off, I think we have to be frank that public health is inherently political. There are political decisions, not just about masks and closure mandates, but about whether to tax cigarettes and alcohol and soda, and whether to take over some land to have safe water for everyone, and whether to mandate policies that reduce drunk driving or pollution. So there are political, policy oriented decisions. What I wish there were less of is partisanship. And to get past that, I think fundamentally we need to work on building trust. And that means better communication. That means emphasizing where we do have shared values. It means connecting through stories. Uh, During the height of the pandemic, I met with a group of Trump voters who were vaccine skeptics. It's coordinated by the De Beaumont Foundation and Frank Luntz, major pollster and thinker about communication. And it was maybe the most interesting thing I did during the pandemic, because what was clear was that these folks, and that was the meeting where one of the people said, I just want to know what the facts are and don't change them. That was in that long conversation, it became really clear to me that these folks were deeply disaffected from government, from the healthcare system, from society, and they really felt that their questions had not just not been answered, but hadn't even been addressed, and that they had been personally vilified for asking those questions. And they were completely reasonable questions. How did we get mRNA vaccines so fast? How do we know they're safe? How do we know whether they're effective? Those are good questions, and they deserve good answers. So I think communication and listening and trying to turn down the volume a little bit, turn down the emotional conflict a little bit. And when it comes to vaccines, remember that the great majority of people still support vaccines, and the gulf between Democrats and Republicans is not nearly as big as it may seem. A recent poll found that 84% said vaccines are safe and effective for children, and that's not changed much since 2020, despite massive amounts of misinformation, some of it from high up in the US government. And yeah, there's some difference, but that was 93% for Democrats and 81% for Republicans. What can you get, 84% of the public to agree on? So I think we do have a lot of common ground, and we need to build on that.
Mhm. And tied to that, I mean, as a public health official, there has to be some tension between individual choice and community outcomes, right? In the United States, we put a huge degree of emphasis on individual choice, individual rights. What happens when those come into conflict with community welfare, right? And vaccines are just one instance of this, but that shows up all quite a bit.
I think that's a really valid and difficult issue because there are things where uh, individual what you want to do may be the most important thing. On the other hand, there are situations where, uh, as we say, your right to swing your fist does not extend to my nose, right? So you really have to distinguish various things, and this gets to the the role of government. What's the appropriate and essential role of government? Are some of these things nanny state? Do they infantilize adults? And I discuss that in the book as well. And what I identify is really there are three broad areas where we rely on government to do the right thing. One is to give us information. Like, I want to make my own choices, but I need good information to do it. So that may be requiring disclosures from companies or doing testing of what's in the environment or whether my drugs are actually safe and unadulterated. So information sharing is one. A second is protecting you from other people's harms. So if a factory in your neighborhood pollutes and you get asthma or cancer as a result, all your self-determination isn't going to change that unless we get together and control that risk. If your kid gets hit by a drunk driver on the way to school in the morning, all you do for that kid may not be able to protect them. So part of what we do is we protect people from other people, whether that's, saying that murder is illegal or that you can't do something that harms others. And the third are things that we can do most effectively together. So yeah, you can boil your own water every day, or you can get together as a community and get safe water that's chlorinated from a safe source. So I think these are three fundamental things that government has a responsibility to do. Different communities may choose them differently, may put the bar differently in terms of how much they do for people or how much they require people do for themselves. But none of this takes responsibility away from people. Nobody's going to put sunblock on you for you, right? Nobody's going to go move your legs. You got to exercise, you got to do things, or you will pay the consequence in less health from less physical activity or skin cancer. So that's not something that you can change. Um, uh, there are things that you can change, and there's some things that societal action will give you more power in your own life.
Mhm. So I appreciate that, and I also just wanna highlight that we're living in a very particular moment where, um, partisanship, as you mentioned, is quite high. You could argue there is declining trust in institutions, including the government, and we still need to find a way to make all this work. So what was the most important piece of advice you'd give to leaders managing and leading in this kind of fraught moment?
Well, first off, I think, leadership has to be situational. You have to understand what the environment is, what the context is. What I've tried to do in the positions I've had the honor to have is to try to identify what are the winnable battles, right? What are the things that they're not going to happen if we don't work on them? If we work on them, they might happen. We're not tilting at windmills. And then there's lots of things that leaders need to do. And I do talk about this in the book, that basically, um, when I had my first big leadership job, which was running tuberculosis control for New York City in the middle of the largest outbreak of multi-drug resistant tuberculosis the US has ever had, I got leadership advice from James Q. Wilson, who was really one of the leading thinkers about government. I don't agree with all of his positions, but he was a really good analyst of how governments work. And one of his first pieces of advice was get support from people outside of government for you to do the things you think need to get done. Otherwise, they're not going to happen. If they happen, they won't be continued. It's a really important point. And part of what we do at Resolve to Save Lives is um, we strengthen the public sector because that's the only way you can reach all of society. We strengthen civil society to pressure and also support the public sector. And we strengthen monitoring so that everybody has a real sense of whether or not you're on track. Keep people honest. And if you're not on track, change it. If you are, defend it.
Very well, that's great. I really appreciate you taking the time. And as a reminder, your new book is The Formula for Better Health: How to Save Millions of Lives, including your own. Thank you so much for the time. I appreciate it, Dr. Frieden.
Thank you. It's been wonderful to chat with you, and good luck to all of your students and the other people listening. There sometimes seems to be, or is believed to be, some sort of a conflict between business and public health. I don't think there is. I think there's a real possibility to use skills for good. I think that'll improve society, it'll improve health, and people who do meaningful work will be happier. So yeah, it's a hard time, but don't get discouraged, because there's a lot of progress possible, and there's more progress possible every day.
Great. Thanks so much.
Thank you.